Whether you realize it or not, you most likely know someone with a mental illness, including bipolar 1 disorder. The symptoms and treatments vary person to person. So joining me now to discuss Mental Health Awareness Month and a new treatment, we have psychiatrist Dr. Gary Sachs, who's the founding director of the Bipolar Clinic and the research program at Massachusetts General Hospital. Dr. Sachs, thanks for spending some time with us.
Yeah, thank you for having me, Rob.
Well, let's first start by explaining what bipolar 1 disorder is.
Yeah, this is a condition that can be very confusing. We used to refer to it as manic depressive illness. And what you'd probably understand about that is that patients who have bipolar disorder have these extreme abnormal mood states. On the high side, we refer to it as mania, and on the low side, major depressive episodes. So transitions between those mood states and normal characterize the life course for patients, and these can obviously be very disruptive and impact every area of a patient's life.
And when I mentioned in the introduction that there are different varying symptoms from person to person, how do those symptoms differ? What are people looking for in someone that has this?
Yeah, so we refer to the mood state by the symptom of mood that's predominant. So mania for the highs and depression for the lows. But when we make the diagnosis, we look at the associated symptoms with each. So there's going to be changes in sleep, energy, appetite, cognition, your ability to experience pleasure. And being in any of those extremes, you could have any combination of those symptoms. And therefore, patients can look really different from each other. And sometimes they can look different from week to week or episode to episode in what they're experiencing and the way they may appear to themselves or their relatives. So it can be very confusing.
And on that note, let's talk about treatment then, because it has, I'm sure, evolved over the years, along with what we're classifying it as has changed as well.
Absolutely. When I started my career, we had just one treatment, and now we have probably about 12 FDA-approved treatments. And as each new agent becomes available, we can actually be effective with, more and more patients. And, this is an opportunity to restore full function to patients. So it really is exciting anytime we have a new option.
And what new therapy and treatment are you most excited about, Dr. Sachs?
Well, I'm just excited to have a lot of them. The most recently available is a drug called Vraylar or cariprazine, and this just came available in March. So as I see patients, I have plenty of patients who so far haven't been fortunate enough to find the right treatment, and now I have another chance, another opportunity to offer something to patients that may well get them better and back to a full life.
And has finding the right treatment kind of been one of the biggest challenges when you're talking about treating these patients?
Yeah, this is not so easy that you can necessarily, find the right recipe to get somebody better. But in the course of time, we have some very simple rules. We continue doing the things that are working and replace the ones that are not working. So if you follow that and you add in self-management strategies, psychosocial kinds of treatments, there really is a very good chance that people will find effective treatment. So I really appreciate you helping us get the word out.
All right, Dr. Sachs, I want to thank you for being with us.
Thank you, Robin.